This demonstration is intended as a resource for previous students and licensed clinicians who can perform dry needling in their practice act and jurisdiction. Please do not attempt dry needling without proper licensure and training. For the low back pain treatment protocol, some precautions to consider are spinal cord injury, arterial injury, dural puncture, dorsal root ganglion injury, superior gluteal nerve artery and vein, inferior gluteal nerve artery and vein, and the sciatic nerve. For this particular treatment setup, you'll insert 8 needles. The first group of needles will be in the lumbar multifidi. You'll insert 2 needles on each side of the paravertebral gutter. Those needles will range from 40 to 50 millimeters in length. The next needle will include the gluteus medius. You'll insert a 60 all the way up to 125 millimeter needle into the gluteus medius. The next muscle is the gluteus minimus, also a 60 to a 125 millimeter needle. The next muscle is the gluteus maximus. You'll insert a 60 to a 90 millimeter needle into the gluteus maximus. And then the last muscle is the piriformis. You'll also insert a 60 to a 90 millimeter needle in the piriformis. We're going to identify the iliac crest first. So I'm going to mark the top of our iliac crest. And then we're going to mark our trochanter. So we'll do that with passive hip internal external rotation. So you can feel, and if I put my fingers, pretty much needs to be, it's not going to be above her butt crack, so it's definitely going to be at or below her butt crack as a starting place for the top of greater trochanter. And then I feel the top of trochanter there. And then I want to get to the superior medial point of the trochanter, which is there. So I'm going to mark just a little half moon there. Now piriformis is going to go from the superior medial aspect of our greater trochanter. It's going to fan over to the medial aspect of the ilium from S2 to S4. So I'm going to cheat and kind of look at where butt crack starts. And that can be roughly S4, then a couple fingers above S4 will give me S2. And then from there, it's going to fan over to the superior medial aspect of the trochanter. So I'm going to get my piriformis there. Glute min is going to be above her trochanter. So I can get glute min right here. Glute med is going to be beneath her iliac crest, so anything below her iliac crest is going to be glute med. And then glute max is everywhere, but I'm going to get one more glute max above piriformis, so I'm going to get glute max right there in the middle. All right, so I'm going to mark the edge of her spinous process. Here's another one. Mark the edge of her spinous process. I'm going to mark a finger width out. Finger width out. This will be my multifidi. Other side, so there's the edge of the spinous process. There's the other edge of the spinous process. So finger width out. Finger width out. It's my multifidi over here. And just like always, we'll maintain a clean technique. We'll always use gloves. We'll always perform an alcohol wipe down. Normally I would just scrub all of that area with alcohol, but since I've got so much drawing on the body for you to be able to see the locations, I just blotted the area with alcohol. All right, so here's my finger on the edge of the spinous process, then a finger without, little tap. Vertical, slightly medial, just like we did in the T-spine, just like we did in the cervical spine. Fingers on the edge of the spinous process, one finger without, a little tap. Vertical, slightly medial. Well, that twitched. So fingers on the edge of the spinous process, little tap. Vertical, slightly medial. Fingers on the edge of the spinous process, little tap. All right, so piriformis, I'm going to find that superior medial aspect of the trochanter, and then we'll come off of that. Little tap with a 60. Send that guy in. Ooh, that's money. Nice twitch. Glute min, very similar. We're going to get above her trochanter. Bracket that tissue. Little tap. And get max. Then lastly, we got med. So we'll do one channel on one side of her paravertebrals, one channel on the other side of her paravertebrals. We'll do her top two together, so we'll do her med with her min, and we'll do the bottom two together. So we'll do max with piriformis. For this treatment setup, we typically run the electrical stimulation for 10 to 15 minutes at a continuous wave frequency with intensity set to the patient's tolerance.